Hello, I'm Dr. Peter Selby, Chief Addictions Division at CAMH. Welcome to the Clinical Practice Tips. In this series, we will focus on effective tapering strategies for prescription opioids. In this video, I will focus on the clinical considerations when tapering opioids. The following video is intended for family physicians and other healthcare practitioners who provide care to patients with chronic non-cancer pain. Precautions for outpatient opioid tapering. The first one is unstable medical and psychiatric conditions. While opioid withdrawal itself does not have serious medical consequences, it can cause significant anxiety and insomnia, and physical symptoms due to autonomic instability. These include symptoms such as a runny nose, watery eyes, yawning, nausea, vomiting, abdominal pain and cramps, and a general agitation that can often get worse if a person has an underlying psychiatric condition. Moreover, these symptoms might actually precipitate a relapse of their underlying psychiatric disorder. We know what happens when somebody is being tapered or the opioid is being stopped abruptly. And it is most apparent when somebody misses their opioid. The locus coeruleus gets activated. And when this occurs, there is this hyperadrenergic state that leads to these symptoms of withdrawal. Another consideration is the use of concurrent medications. Ideally, avoid sedative hypnotics drugs, especially benzodiazepines, during the taper. I say this because the combination of benzodiazepines and opioids are a fatal combination in overdose. This together can cause very significant respiratory depression. Now you may say the person's being tapered off their opioids, so what's the risk? The issue is that often when people are in distress, they will reach for their benzodiazepines, they'll reach for their opioids, not understanding that when taken together, this can lead to very significant respiratory depression, and there have been several case examples of this leading to death. The other consideration is whether this person is obtaining opioids from another prescriber or even from the street. In these situations, outpatient tapering is unlikely to be successful. Such patients are usually best managed in an opioid agonist treatment program or a withdrawal center. And if you're interested in knowing more about the use of methadone or buprenorphine for patients with addictions to opioids, then please look up our website at knowledgex.camh.net. A particular issue when dealing with opioid tapering in women of childbearing age is pregnancy. Severe acute opioid withdrawal has been associated with both premature labor as well as spontaneous abortions. If your patient is pregnant, it is ideal to refer her to a specialty service because often they need transfer to an agonist treatment or very careful and monitored tapering. Lastly, you want to ask yourself, is this patient right for tapering? Questions to consider are, is this patient stable, or does this person have comorbidities, both psychiatric and medical, that could get worse should you attempt a taper? Does this person have one pharmacist, or are there multiple pharmacies involved in dispensing medications to this patient? Ask yourself, how motivated is this person to engage in the tapering process? Or are they just reluctant participants? And lastly, do you have a good therapeutic relationship with this patient?